Dr. Zymantas, tell us, there are things called one-day implants, and then there is this other implants. Why would anybody go and do an implant where you have to wait months and months to get it all done when there is such a thing like a one-day implant, or does not everybody qualify for a one-day implant? Tell us about it, please.
There are phases, different kind of techniques and technologies out there now. One of the newer technologies is called All-on-4. Where you place 4 implants and you can immediately place a bridge, a superstructure on top of the implants that can be a provisional type of a bridge that you have to wait 4 months until you get the final true prosthesis completed. The bone still has to integrate into the implant, and because there's a little bit of a chance of things shifting in the 4 months, you don't want to be putting a final prosthesis, which is relatively expensive from a laboratory standpoint. You want to be able to be secure that there's not going to be any movement and you're going to have a stable base. If you are replacing just one implant, with one tooth with one implant, it sometimes is a little bit more difficult to allow it to be in function, and you have a greater risk if you have a single tooth implant. You have a greater risk of failure if you have any kind of micro movement, any kind of jarring movement. It's kind of like if you had a broken arm and you kept opening your cast every other day and shaking the arm. The arm would not be able to heal properly if you kept shaking the arm. And that's what happens if you would place a immediate prosthesis sometimes on a immediate implant, and if you had function on it, then it would be jiggling around in the bone a little bit, and it would not bond properly to the bone.
And when you say prosthesis, what you mean is the crown, the cap on it, on that metal stick which you put into the bone, right?
Correct. The tooth replacement that would be placed on top of the implant, correct.
So basically both of these technologies exist, but depends on the structure of the bone and how stable it is. A patient might be able to do a one-day implant, or he might not.
Correct. It's very patient specific, and again, there's different technologies, and some people take more risks. Some doctors are more may be a little bit more risk. Maybe want to take a little bit more risk, as long as the patients are aware.
Okay, I got it. Well, thanks for clarifying that. Bye-bye.